Mushrooms and immunity. And perhaps some of us are wondering, okay, how is this word mushrooms connected? It's about empowering patients in the oncology journey. And as we speak about beyond treatment, healing beyond treatment, and we've heard from our other presenters, we know about the journey, but we also know that there are so many different paths and innovations, all designed to heal and certainly to treat. And so this presentation will be offered by another friend of Cancer Support Services. I'm not sure how many years you've been with us. 4 years, and always bringing a fresh dimension to the presentation. He's Director of Supportive Care and Integrative Medicine at the City of Hope, Atlanta. He has dedicated his career to bridging conventional oncology with evidence-informed naturopathic and functional medicine. Interesting. He has led multidisciplinary teams at institutions where he developed integrative care models that improve patient quality of life and treatment outcomes. And his clinical philosophy is centered on personalized, whole-person care that addresses the physical, the emotional, and the biochemical needs of individuals navigating cancer. Beyond clinical leadership, he has contributed to research, education, and professional development in integrative oncology. And he remains committed to advancing the field through collaborative research, clinical innovation, and mentorship. Mushrooms and immunity, empowering patients in the oncology journey. A presentation offered by Dr. Daniel Kellman. Please do welcome him.
All right, good afternoon. Thank you, Antoine. I'd just like to say thank you to all of the patients and caregivers that are here, all of the providers, and especially to Cancer Support Services for bringing me back to the island for the fourth time. First time was 2019, second time was 2021 during COVID, and that was very interesting. I think all of you had masks then. And then last year, and then again this year. So it's a real pleasure. Really want to thank Jan Linton for all of her dedication and hard work all of these years. I've been with the organization that I've been working with now for 19 years. So like Jan, started when I was 12 years old. So I'm going to tell you a little bit about City of Hope very briefly, and then I'm going to tell you about something that I think is a nice little bridge between conventional oncology and where kind of science meets nature, and hopefully it'll be interesting to you, especially after lunch, before the sedative effect of the food starts kicking in here, the tryptophan. So City of Hope actually started in 1913 treating tuberculosis in the desert in Southern California. That dry desert air was actually something that people with TB responded better. Fast forward a few decades and antibiotics were discovered, and the board at that time, because there had been a campus that had developed there in a little village called Duarte, which is now near modern-day Pasadena, California. They decided, well, let's change the focus to diabetes and to cancer care. Well, some of the efforts that City of Hope engaged in science and research, and a lot of philanthropy helped really develop a campus and laboratory medicine. Through those efforts, developed synthetic insulin on the campus of City of Hope. So obviously that was a huge contribution to medicine and has saved many lives, not only across the US, but across the world. So there's been a long tradition of research, and fast forward many years, City of Hope acquired the Cancer Treatment Centers of America hospitals. So we went from a for-profit, family-run hospital business to a non-for-profit organization. The benefit of a non-for-profit is that there's a lot of philanthropy and giving that has pushed research forward in a lot of ways and is really advancing some of the more novel investigator-initiated trials, even beyond some drug trials. So I'm really delighted that when the family decided to sell, that we had a suitor such as City of Hope. This map here shows where we currently have hospitals. There are 2 large hospitals now in the Los Angeles area, one in that original town of Duarte. It's our biggest campus. And then also our newest hospital, which is in Orange County in Irvine. The 3 remaining Cancer Treatment Centers of America hospitals, Chicago, Atlanta, and Phoenix, were also acquired by City of Hope. City of Hope also owns a company called TGen, which was actually the company that was funded to map out the human genome. This was a 10-year, $10 billion project that mapped out the first human genome. The benefit of that is you can actually map out the genome of cancer tissue now. So you can find in the cancer tissue, not at $10 billion, but just for a few $1,000s, that's how the technology has increased, and not 10 years, but a couple of weeks. You can find mutations and drivers of cancer that show the vulnerability of cancer to certain treatments. And if something is in sort of maybe an academic phase, somebody might be able to get in a clinical trial that fits that specific mutation. And this is where you find some amazing things, sometimes even curative results for patients even with stage 4 disease. So this is just an idea of where the science has gone. City of Hope also became very famous for bone marrow transplants. We've done the most bone marrow transplants of any organization in the US, and have actually now hit 20,000. This data is from 2023, treating about 150,000 patients a year. And as you can see, there's a very large philanthropic effort that goes into City of Hope, and we do things like big fundraiser galas in Los Angeles, and all the way to just something called the Walk of Hope, which we just had a few weeks ago in Atlanta, and we raised $200,000 just from the local efforts, and then there was a company that matched that donation. So this is advancing things faster than, say, just relying on NIH, which has been somewhat defunded recently, and just relying on pharmaceutical trials. So what we're really proud of is having everything under one roof. So we have medical, radiation, and surgical oncology. We also have some of the specialties like endocrinology and gastroenterology and cardiology on site. We have a pharmacy, we have a 50-bed inpatient hospital, and we also have the integrative services. So I'm director of the supportive care and integrative medicine. I'm also a naturopathic physician by trade. So I see patients about 50% of the time and do management of the 5 teams that I'm over about half of my time. So in my particular department, naturopathic medicine, for those of you that don't know what that is, we help support patients along their journey to try to maximize their quality of life and decrease side effects of the treatments, and then focus on prevention. So we use herbal, homeopathic, vitamin mineral support. We try to minimize some of the pharmaceutical interventions by offering things that might, say, lower liver enzymes or help reduce pain and inflammation in the body more naturally, and try to reduce some of that pharmaceutical burden in the body. That extends to many other modalities that we have, like chiropractic and using a cold laser treatment, and in the past, acupuncture. It's something else we're trying to get back at our hospital as well. So supportive care is really taking a whole person approach to care to minimize suffering and maximize the quality of life. This really reminds me of everything that's been talked about today, addressing practical, social, emotional, psychological, spiritual, and physical concerns. Now in the US, the Medicare and Medicaid services, also known as CMS, has mandated that we do social determinants of health screening for every patient every 90 days to make sure that there's no food, housing, financial, or transportation insecurities that might be a barrier to them getting treated at our hospital. And so I love that because it's bringing about a lot better health equity and access to care. That's been a really big issue. And so this is something that we just really implemented in the last 6 months very rigorously. So I'm going to focus on the immune system, and why that matters is because the immune system is important for detecting and going after cancer cells and destroying them. The immune system can also be helpful in reducing side effects and also in recovery and resilience in the prevention phase. So a little immune system 101, we have the lymph nodes. They act as little filters. They trap germs, and then they alert the immune system that there's a foreign invader. We have also the thymus. This is a training ground. It's kind of a training ground, maybe in military terms, like for our Navy SEALs or our Army Rangers, right? This is where the special forces get trained on how to detect and recognize cancer cells, for example, and viruses. We have the lymphocytes. Those are the T cells, okay? These are cells that are natural killer cells. They are the ones that can go and destroy the cancer cells and also viruses, for example. They also are helper cells. They help other immune cells to operate. We have macrophages. You see that yellow one? It looks like a Pac-Man. These are the big eaters. They go after bad cells in the body. We have the appendix. Not really much was known about the appendix, but they now believe that it does store a lot of good bacteria, and there's a lot of discussion about the microbiome. 70% of our immune systems actually reside in the digestive tract. We have the bone marrow. This is where all of the cells are manufactured. All the red blood cells, all of the white blood cells, all of our immune cells are manufactured in the bone marrow. The spleen, it's kind of like a big lymph node. It's a filter, a blood filter, and just a very intricate system that we have. So obviously the immune system is very, very important. So conventional medicine, we'll step back and look at that, has come a very long way in being able to offer treatments that aren't just the traditional chemotherapy and radiation and surgery route. So there are immune checkpoint inhibitors. So for example, for melanoma, that was one of the first cancers treated very effectively with immunotherapy. There was a drug combination called ipilimumab and nivolumab. These are monoclonal antibodies. One of them basically will take the brakes off. In other words, just kind of open the key to the T cells, those immune cells, to go after cancer and recognize it, because it kind of lost its recognition when cancer sent little messengers to kind of block the T cells from doing their job. So these checkpoint inhibitors basically unlock those immune cells. There are also ones that put little markers on the surface of cancer cells to then alert the T cells to go after them. So the immune system can do an amazing job. It's just that something has happened. There's been some dysfunction there that has allowed, and many, many things have to happen to allow the cancer to kind of take place. CAR T therapy is where you take the blood out, you run it through a pheresis, and you pull out the T cells, and then you modify those T cells to recognize the cancer and go after it. This is a very, very powerful therapy and is showing a 90% cure rate for lymphoma or for leukemias, and it's being studied in many other cancer types right now. Speaking of philanthropy, there was a gentleman by the name of Schwartz in California who was diagnosed with a lymphoma, and this was around 2004, and you can read about the story on the City of Hope website. But he was treated, with chemotherapy and maintenance therapies, and through about 15 years, did really well. Then his lymphoma just exploded. He had big, bulky lymph nodes. Nothing was responding. And so his hematologist, oncologist, decided to offer him this clinical trial with CAR T, again, where they take the T cells out, they kind of turn them into supercells, and then they go after the cancer. And he was cured of his lymphoma. He donated $20 million. Now it's called the Schwartz Center. And that's on the campus of City of Hope. So this is sometimes how things happen in cancer treatment. And, you know, vaccines were talked about today. I mean, even the mRNA technology has potential usefulness in treating cancer. And so there's experimental work being done with vaccines towards various cancers. And then, you know, the best cure for cancer is really early detection and early treatment and prevention by using maybe vaccines that we already know, like the HPV vaccine that was talked about so eloquently today. So how does integrative and supportive care help immunity? Well, we reduce inflammation. That helps the immune system just through things like healthy diets. When we correct blood sugar abnormalities, there's better immune system function. So just being able to manage blood sugar better. So that's part of that holistic whole person approach. We know that an anti-inflammatory, more Mediterranean style of diet, a diet rich in all kinds of fruits and vegetables and phytonutrients, all the different colors that are on the plate, like today, you know, that is cancer fighting because it's anti-inflammatory, and there are nutrients in there that have anti-cancer properties. Acupuncture may regulate immune function by influencing what are called cytokines. Some cytokines are inflammatory, other are anti-inflammatory. Acupuncture engages those cytokines in a way that would have less inflammation and reduces stress. Stress is related to a chemical called cortisol. When we lower cortisol levels in the body, we actually have better immune system function. So that's why practices like prayer and meditation, yoga, guided imagery can reduce those stress hormones and actually have a powerful effect on our immune system. So, you know, this is kind of proving that the whole person approach actually scientifically helps in treating and preventing cancer. Movement helps improve immune cell function, so exercise, and it reduces inflammation. A healthy gut microbiome, so all those good prebiotics and probiotics and keeping the gut healthy has a very powerful effect on our immune system. And there's a lot of study done on that ongoing, showing, for example, that a diverse microbiome in the gut in combination with immunotherapy drugs like the pembrolizumab, for example, actually improves the effectiveness of those treatments. So definitely more to come with that. So what are medicinal mushrooms? These are things that you can eat or make teas with. They come in capsules and powders and various extracts. They've been used for centuries, really, especially in China and Japan. And they've been used more recently, the past 30 years, actually, as approved adjunctive treatment in Japan and China in combination with chemotherapy, for example. They're rich in certain compounds like beta-glucans, polysaccharides, and triterpenes. These are all very powerful immune-boosting substances found in the medicinal mushrooms. You may have heard of some of these: reishi, turkey tail, maitake, shiitake, cordyceps, lion's mane, chaga. They all have their own special properties. Some may help the nervous system better. Some may help energy better. Some may be better for the heart. Some may reduce inflammation better. But they all help the immune system. And so one of the beautiful things about them, unlike some herbal medicines may interact with pharmaceutical drugs in the liver because they're competing for enzymes known as cytochrome P450 enzymes. These are enzymes that break down drugs and herbs. Sometimes they compete. Mushrooms seem to have very little interaction potential, so that's why I really like to use them with patients. They're very safe in that way. As you can see, there's a couple of little things like reishi is great for immune support and stress relief. Cordyceps, more for energy and stamina. The lion's mane, more for brain health, may offer some benefit for what we call chemobrain and cognition. Turkey tail with gut health, but they all kind of help in all of these ways. Chaga has substances in it that may help block the formation of melanoma in the body. So these beta-glucans stimulate those macrophages. Those are those little Pac-Men that I was talking about, and the natural killer cells. Polysaccharides, the PSK, is shown to enhance immune response in cancer patients. The antioxidants can reduce that inflammation and the oxidative stress in the body. So not just helpful in cancer treatment, but also helpful in general for prevention, overall health. One of the things I really like about the mushrooms too is that they're immunomodulating. So that means if you have an overactive immune system, say an autoimmune disease, it will quiet those immune cells down. If you have an underactive immune system, it will boost those cells up. So they're what we call adaptogenic in that way. So this particular review from this year showed, looking at all the medicinal mushrooms, that there's a survival benefit in 2 separate hepatocellular carcinoma or liver cancer studies and 1 breast cancer study. There's been 11 studies showing improvement in immune response. Quality of life improved in many of the studies done. There's a very low side effect profile. There were some small amounts, typical to any study with nausea, vomiting, diarrhea, and muscle pain listed as the most common side effects. But again, you're talking about like 1% of people having that. So very low side effect profile. There are limitations to these studies. We need larger clinical trials and randomized controlled studies on these, and they were limited by a small sample size. So reishi, they call this the mushroom of immortality in China, in Chinese medicine, but it has been used for over 30 years as an adjunct to cancer treatment in Japan and China. It is an immune modulator. It's very rich in vitamin D, which is interesting because vitamin D is involved in immune modulation when we have adequate levels in the body. It does support the anti-inflammatory response in the body. There was a study showing enhanced immune response in advanced stage cancers for those natural killer cells, the CD3+, it means, all the different T cells. There was a study showing helping energy level in breast cancer patients that are undergoing the endocrine therapy. That's the estrogen blocking therapies. And there were patients who achieved stability of disease with reishi that had gynecological cancer. I have some theme music. Turkey tail, this is one I think that I'm probably asked about the most when I first meet with patients. They want to know about turkey tail, so there must be a lot of information on the internet about that one, but there have actually been some good studies. It probably has the longest history when you do sort of a Google or an AI search. PSK is very high in this particular mushroom. It shows improved survival when used alongside chemotherapy in colorectal cancer and stomach cancer and gastric cancer. And it is approved in Japan as adjunctive therapy with cancer patients. Shows enhanced natural killer cell activity. Are you seeing a pattern here? And one of the naturopathic medical schools in the Northwest, Bastyr University, has been doing a trial, and they are seeing good results with that. It just has not been published yet. There's also studies showing that it improves the bifidobacterium and lactobacillus in healthy adults. So we know that it helps the microbiome. Maitake, this is one that I use a lot with patients. We've been using it for years, and we see improvements in platelet counts for patients on chemotherapy, also improvements in white blood cell counts. This is just something we observed and kind of based that on safety studies and small cell studies that were done. There were no real big clinical trials, but we've been using it very safely, effectively with patients for many years in our practice. In studies, Maitake did enhance the immune response, such as activation of those macrophages, T cells, natural killer cells in patients with breast, lung, and liver cancers. The shiitake, this is one that I actually eat a lot because it's at the farmer's market that I go to, and they're delicious. So I will chop up some garlic and some onion and then slice the shiitake, and it has a really nice meaty flavor. Maybe add a little bit of soy sauce to it, have it over rice, delicious. Medicinal mushrooms are a great culinary treat and can mimic meats in many cases. And places like Australia, they're starting to make a lot of meat substitutes and burgers out of meats, and they're pretty tasty. I've had some of them. Lentinin is the substance in shiitake that has been extracted and has been shown to help the immune system in that modulation function. It may synergize with chemotherapy to actually improve the effectiveness of the treatment as well, and has been shown to improve survival rates in Japan and China. The U.S. American Society of Clinical Oncology does show some promising evidence, but still say kind of limited. A lot of the studies are still preclinical or not controlled in their cohorts, so they don't have that sort of like placebo control. Cordyceps, now this is a very interesting one. Probably the makings of a great horror movie. There's actually, I think it's called The Last of Us. I was reading about it actually last night. It sounds very interesting, but what it does basically is the spores will travel, they'll land on an insect. The spores will then start to grow and put mycelia, these little roots inside the insect, and start to use its nutrients to grow itself. Eventually it takes over the form of whatever it looks like that particular insect, and then it grows a mushroom out of it called a fruiting body, and that fruiting body has all these different medicinal effects, and has really been shown to be great for that kind of recovery, for energy and strength. It's been shown to actually induce what's called apoptosis or apoptosis, which is the programmed cell death of cancer cells that our immune system normally does when it's working well. And it also can restrict new blood vessel growth to tumors through something called angiogenesis inhibition. So a very, very interesting potential drug was created by Nucana Biopharma and Oxford University collaboration. So it's been shown to target many different cancer-related pathways of growth. So some really exciting stuff with cordyceps. So that's my lecture on medicinal mushrooms and the immune system. I'm available for any questions if anybody has any. Thank you. Dr. Russell has a question. Well, I guess we'll bring the mic.
Right. First of all, I am very pleased with how you broke everything down in a simplistic way to understand how the immune system functions in fighting cancer. So I thought it was a great presentation.
Thank you.
I have a great interest in that subject matter in terms of the alternative things that can be brought to bear. And I have been interested in mushrooms for some time, but now getting information from you, being on the scene, it helps a lot. Specifically, is there a dosage regimen? Is there a particular combination that you use with the mushrooms? Is it that you use specific ones for specific cancers? I'm very interested to hear.
Yep, that's a great question. Thanks for your comments, too. First of all, it's important to get high quality. This is not a pharmaceutical drug that's regulated by, say, the FDA in the United States. So making sure if you buy any mushroom extracts, make sure that it's been third-party tested for purity and potency. That's very important. First of all, making sure that, that it's safe that there's no toxicity there, but also that the specific milligram amount and the extracts are verified to be in there so that it works. So there really aren't guidelines other than, say, what some of the preclinical studies have suggested. But the company Host Defense, for example, was founded by Paul Stamets. And he used a lot of the sort of calculations based on a lot of studies, their ongoing preclinical evidence to come up with doses. So, and most companies are, mimicking that. So, for example, if someone's using turkey tail, because it does show a lot of anti-breast cancer effect, I would recommend 2 capsules twice daily of, say, the Host Defense turkey tail mushroom. If someone is having some, say, chemobrain issues, I might recommend they add in the lion's mane. If someone is in general prevention and they want kind of a nice combination mushroom, that there's the Stamets 7 or the one called Myc Community, MYC, meaning mycology or mushroom. Kind of a tricky little name, but there's a lot of good companies out there. It's very popular now to provide medicinal mushrooms. But even eating your typical button mushrooms or the portobellos, they have beta-glucans in them. We can eat them. We can enhance our vitamin D levels. We can use extracts. We can make teas from them. So I would just say use them in your daily or several times a week life, so that you're getting exposure to those polysaccharides, to those triterpenes, to those beta-glucans, and working with maybe someone who's a little familiar with, say, the specific qualities or properties, you could maybe come up with a plan together that would be suitable. I know that was avoiding, because I don't really have a direct answer for you on that.
Honestly, I appreciate your answer. As a comment, the difficulty with the naturopathic approach is there really isn't any funding in comparison to Big Pharma, because there's no financial incentive. So it is a challenge to get that hard data because there isn't money driving the studies to get the data. And so I think, what you're saying is over time, as more people do the trials with it, it will become more mainstream, just as other things have in the past. So I do appreciate the information you give, and I'll be doing a lot of research. Thank you.
Thank you for that comment. One thing that Dr. Russell mentioned about funding, speaking of philanthropy, there's a family that owns the Panda Express and the Panda family of restaurants. You may be familiar with their orange chicken. They donated $100 million to City of Hope a few years back and have founded the Churng Center for Integrative Oncology. So now we've put forth application for pilot studies in various areas of natural medicines, herbal medicines, psychology, mind and body approaches, diet, all kinds of things. So that's the kind of thing that has to happen at this point is philanthropy, right? Because a lot of times there is no return on the investment for a pharmaceutical company when something isn't patentable, right? So, we just got approved at our hospital, for example, in studying an herb called Boswellia, which is an anti-inflammatory, and we're going to look at working alongside a radiation oncologist. They notice something when radiation is given to the brain, that there's an effect sometimes called radionecrosis of the brain. And Boswellia has some of the compounds in there may help improve that and prevent that from occurring. So that's really our first approved study through this Churng grant that we're just starting right now. So yeah, good timing. Any other questions?
Dr. Kellman, just one quick question for you. I am not a big lover of actually eating mushrooms. So I just want to know, are the supplements just as effective as eating the fresh mushrooms?
Yes, probably even more effective on a medicinal level when they're extracted, because you're taking out certain percentages of those active constituents. You know, I think there's wisdom in the culinary aspects too, and kind of, you know, what your body knows what to do with food often. So I think using a combination of both. My wife hated mushrooms before she met me. But you know, I've gotten better at cooking through the years. In fact, I think I do most of the exciting cooking in my house with fish and mushrooms and garlic and these kinds of Mediterranean style of cooking. But she loves them now. So, but it, you know, some of it's really texture, you know, getting the texture right. And YouTube and Facebook and all the places have become a good friend of mine for, you know, learning how to cook better. So you can learn a lot.
So each, as you mentioned, each one has its own main specific, and you did say that turkey tail in itself is more related to the breast cancer side of it. But is it okay then to take, because the other sides they have for anti-inflammatory immunity, so it's fine to take a combination supplement, one is just as effective as well?
Absolutely. A lot of the combination formulas use like anywhere from 5 to 10 different mushrooms. So yeah, very safe to use them. And they all seem to have anti-inflammatory effects. They all seem to have some effect on energy or immune system function, but you can kind of focus on one a little more to get some extra effects that you might need. So
Thank you.
you're welcome. Yes.
Good afternoon. My question is not about mushrooms. My question is about Belgian bush tea. And of course, is it okay to use
No.
soursop
Oh.
when persons are undergoing chemotherapy?
Yeah. Oh, so you're asking about bush tea, sursi, and soursop. Yeah, yeah. So soursop is one of those that is in also very preclinical. So there are anti-cancer properties of the soursop leaves and fruit. The issue is it's become very much a viral on the internet, and a lot of people are, you know, using concentrated extracts and various teas, and there's really no real standardization with that one. The only study that has been done was actually a little bit of a negative study as far as human studies go. And that was done from the University of Puerto Rico, looking at a Caribbean island, I think it was maybe Dominica, where they use a lot of soursop. And there was a higher incidence of the Parkinson's-like issues in that particular patient population. So there may be some toxicity to it. Perhaps that's actually where some of the potential chemotherapy benefits of soursop might be, because chemo can be toxic, right? So maybe there is some, you know, quote unquote poison in there that is affecting the nervous system. I mean, Taxol is a very common chemotherapy, hurts the nerves, you know? So maybe there is something to it. It just needs further study. I would say it's very safe to use if you're just doing like the traditional 3 to 5 leaves in a tea. I'd say that's very safe. I haven't seen any patient have a problem with using that.
Thank you. My question is kind of at an overview sense. Now, if you look at what we would call conventional approaches and alternative approaches, and the mushrooms will come under the alternative approach, I assume. I use alternative approaches when I was ill myself, and the person that helped me through that was of the view it's one or the other. I can't use conventional and the alternative. And if I go conventional, I'm undermining the work that he's doing on the other side. What is your view on that?
Yeah, we need to bring everything together. You know, I think it was even mentioned, you know, Dr. Anissa just talking about, you know, she's the one who brings some of that toxicity, but also when we do things correctly, when we have proper screening and getting things caught early, then we have less toxicity because the treatments are less invasive, right? But one of the things I did mention in this lecture was how the mushrooms may actually enhance the effectiveness of the treatment. They may help white blood cells and platelet counts to prevent treatment delays. So these things, if they're used in an artful way, may actually help improve outcomes for the oncologists and save money, possibly, right? I think it was mentioned the immunotherapy drugs, being $30,000, $40,000. When they first came out, they were about $200,000 per injection. When you think about a drug like Neulasta, $8,000, $10,000, $12,000 to boost the white blood cells. Some patients are needing that with almost every chemotherapy cycle because their white blood cells get hit so much. Maybe a mushroom extract or a Chinese herb like astragalus that we use pretty often can boost those white blood cells, prevent the need for Neulasta injection, hence saving thousands of dollars. So on the one hand, the oncologist has a right to be concerned because there are a lot of potential interactions that could decrease the effectiveness of the treatment. Certain antioxidants and levels of antioxidants you wouldn't want to use with radiation therapy because the goal of radiation is oxidation. So if you're using antioxidants, that could interfere. But you have to just, use them all together in a way that allows each one to be present. And so that's what we're seeing. That's what integrative really is all about, and supportive. Does that make sense? Okay. All right. Thank you very much.
Thank you. Thank you very much, Dr. Daniel Kellman, as we take a look at mushrooms and immunity, still on the path of empowering patients in the oncology journey.